Hello, I am Dr. Sheila, better known as the Pelvic Coach, and today we are going to talk about pelvic floor relaxation. That is one of the reasons that I gave you on one of my previous small talks on why you might have bladder leaks. And you know, of course, my mission is to eradicate bladder leaks for most women if there is not a medical cause that is associated with it. That makes it a little bit more difficult. However, in some cases, not so absolute that you will not get some relief, maybe not full. But that being said, we're going to talk about pelvic floor tightness and pelvic floor awareness. What I want to do today is do just an exercise with you to help you to maybe visualize and feel the muscles of your pelvic floor and actually practice relaxation for them. It's best done with breath and sitting or lying down, of course, because you want to be relaxed. But there are also some exercises that can help you to relax those muscles just a little bit. Today we're going to get really just into the meditation or body awareness aspect of your pelvic floor. So as you can remember, your pelvis, if you just take your hands and put them on your hips, those two bones that are protruding on the side, that is the upper part of your pelvis, and your pelvic muscles lie down kind of in the bottom of that to support your pelvic organs. Everything has to work smoothly so that your bladder, uterine, and actually rectal function will be the way it's supposed to be. So you really want to, and the body is really good at trying to get back to homeostasis, as we say, but getting back to the way it is designed to work. But sometimes it needs a little help depending on what has been going on with your body, what you've done, or just even just life in general. So let's take maybe a few minutes and go through a pelvic floor relaxation exercise. So when you do this, you want to think about being in a quiet room, minimal to no distractions, because you really want to focus on the area that you are trying to relax. And it's difficult to do that if you're getting up checking on something, if you know your child's calling you, phone's ringing, etc. Just wait, maybe my phone will ring while I'm talking, but let's hope not. So to do this, we'll do it in sitting. Okay, so you're going to put your feet flat on the floor. And you can sit actually supported. So you can sit supported in your chair if your chair is relatively upright. You don't really want to slouch down because there is a breathing component here. And you want to make sure that you have enough room for your ribs to expand and contract. And of course, for you to have enough space. So you don't want to squish down and not have enough area. So sitting up nice and straight if you wish, depending on where you are, or sitting back slightly if you have enough support, feet flat, hands down at your side. So first start out closing your eyes and just breathing normally. So close your eyes and breathe. And just want to start to slow down your breath. So inhaling for 5 counts. So inhale and hold it just a second. And then a slow exhale, either 5 or 6 counts, 5 or more. Exhale. Inhale again slowly. And exhale. And as you're breathing, you're feeling your ribs expand, coming out to the side. Good. And coming back in, no chest breathing. So now as you're breathing, so remember your eyes are closed. So now as you're breathing, you want to really take your breath and focus on your pelvis. So inhale and feel that air going into your pelvic region. Inhale, even that pelvis expands with air. And exhale, slowly coming back. to neutral. Again, inhale, thinking of your pelvic floor, air flowing towards your pelvic floor. And slowly exhale. I'm going to do that a few more times while I'm speaking. So I'm going to speak as you're inhaling for 5 counts. And then slowly exhaling for 5 counts. So we're going to add on now, as you inhale, and you're going to let that breath go into your pelvic floor. You're going to also focus on the muscles relaxing. You should actually be able to feel them dropping and opening slightly. It's very subtle. It's not really that you're going to feel a heavy drop or anything like that. But just going to keep breathing and focusing on your breath within your pelvic area. And seeing if you can, just like you isolate when you go to a class, or if you've ever done this, and you can isolate, okay, relax your feet, relax your hands, relax your jaw. It is the same principle. Think, relax your pelvic floor. We're going to just take 2 more breaths here. And hopefully you kind of have where I'm going with this. I'll check again on one of my other talks just to make sure that you can feel that expansion. And sometimes it does take practice. So if you don't feel it in the beginning, do not get discouraged. Don't get discouraged. So we'll do 1 more. We're going to inhale. Air flows into your pelvic floor. And exhale, feel it dropping down towards your seat, relaxing everything in the area. And you can keep going with this. I'm going to leave you now, but you can keep doing this. I want you to think about practicing this every day for 5 minutes, especially if you have any, discomfort, pain, of course, in your pelvic floor. But I do want to preface that by saying that if you do, please, please, please go and see your doctor, or speak to your doctor, your health professional. Speak to someone about it because it actually is not normal. And this is just giving you some advice, but it's actually not a substitute for you going to the doctor and getting whatever information you need in order to heal. That being said, I hope that you were able to feel your pelvic floor, that you were able to relax your pelvic floor. And until next time, I will see you. Make sure that if you enjoyed this, you can go ahead and subscribe to the channel, and also comment if you wish. You all take care. Bye-bye.